Assalamualaikum and a very good morning to Professor Zainal and everyone. So today I will be presenting my SSM assignment with the title of Allergy and Immunology. This is the table of content of my SSM assignment. So what is meant by immune system? Immune system is the body's defense responses that will protect our body against harmful microbes, and it is divided into two types, which is first innate immunity and second is adaptive immunity. Innate immunity is the body's first line of defense that we are born with, which acts quickly and non-specifically, meaning it will attack all germs in the same general way and without recognizing any specific types. Meanwhile, the adaptive immunity is the immune response that specifically recognizes and remembers pathogens to protect the body more effectively upon future exposure. Next, what is allergy? Allergy is one of the hypersensitivity type, which is hypersensitivity type 1. Allergy also is a harmful overreaction towards harmless substances, which will lead to the release of inflammatory mediators and causing symptoms. And what is immunology? Immunology is the study of how body protects itself from disease. Now I'll be explaining about the anatomy of immunology and allergy, which is the lymphoid organ, and it is divided into two types, which is primary lymphoid organ and secondary lymphoid organ. Primary lymphoid organ consists of two organs, which is first bone marrow and second is thymus. So the first organ, which is bone marrow, is a soft tissue found inside the bones that produce blood cells and immune cells. And this bone marrow has two types, which is red bone marrow and yellow bone marrow. Red bone marrow is active and makes red blood cells, white blood cells, platelets, and as well as lymphocytes for the immune system. B lymphocytes are produced and mature in the red bone marrow, while T lymphocytes are produced in the red bone marrow but mature in the thymus, which is why red bone marrow is considered as primary lymphoid organ. While yellow bone marrow mainly contains fat cells and usually inactive, serving as energy storage, but it can convert back to red bone marrow when the body needs to produce more blood cells, such as during infection or blood loss. So next is thymus. Thymus is a gland found behind the breastbone and in front of the heart. It is a bilobe organ divided into smaller lobules with an outer cortex and inner medulla. The cortex contains many immature T cells, while the medulla has a fewer cells and contain more mature T cells along with the thymic or Husserl's corpuscles. The main function of the thymus is the T cell maturation, where immature T cell precursor from the bone marrow travel to the thymus, and where they will undergo positive and negative selection to make sure they can recognize foreign substances but do not attack the body own cell. And only properly selected T cells are allowed to leave the thymus and enter the circulation. Now I'll be presenting about the secondary lymphoid organ, which consists of lymph nodes, spleen, and tonsils. So lymph nodes are small pin-shaped organs that found along the lymphatic vessels. When lymph flow through them, harmful substances like bacteria, viruses, or cancer cells get trapped inside. Immune cells such as macrophages and dendritic cells then show these foreign substances to T cells and B cells, which activates the immune response. The activated lymphocytes multiply quickly, where the B cell will produce more antibodies, and some cells become memory cells to protect the body in the future. During infection, lymph nodes often swells because many immune cells are being produced to fight the pathogen. So next organ is spleen. Spleen is an immune organ that mainly protects the body from infection in the blood. It is found in the upper left abdomen. Its job is to filter the blood, remove off blood cells, bacteria, and other waste. The spleen also helps the immune system by allowing T cells and B cells to detect foreign substances and produce antibodies, which are especially important for fighting certain bacteria. And in addition, the spleen stores extra immune system and platelets. When the spleen is removed or not working properly, a person becomes more vulnerable to a serious infection, showing how important this spleen to immunity. So the last organ, which is tonsils, are two round fleshy masses in the back of your throat, which in the pharynx. Part of our immune system, tonsils are just like lymph nodes function. They help to filter out the germs that enter through our nose or mouth to protect the rest of our body from the infection. And also, tonsils are also called palatine tonsils and facial tonsils. So now I'll be explaining about the mechanism of the immune response. So the immune response will begin when the innate immune cells detect pathogens using the PRRs that recognize PAMPs, leading to inflammation and activation of antigen-presenting cells. Then the antigen-presenting cells will present antigen on MHC molecules to the T cells. MHC1 will activate the CD8 plus T cell, while MHC2 will activate the CD4 plus T cell, resulting in T cell activation. Then activated helper T cells will guide the immune response. B cell will produce antibodies, and cytotoxic T cell will destroy the infected or abnormal cells. And some T and B cells will remain as memory cells that will provide faster and stronger protection upon re-exposure to the same antigen. So now I'll be presenting about the type of hypersensitivity, which we have 4 types, and the type 1 hypersensitivity, which is allergic, is the topic that I'm choosing for this SSM assignment. So type 1 hypersensitivity is about IgE mediated that will occur within minutes and sensitize individuals. So what does happen in this type 1 hypersensitivity? The mast cell and basophil degranulation will release histamine and leukotrienes and will lead to allergic rhinitis, asthma, urticaria, and anaphylaxis. So next, type 2 hypersensitivity, it is about IgG or IgM antibodies that target the cell surface antigens, and it will causes complement activation or ADCC, leading to cell destruction, and it will lead to hemolytic transfusion reaction or hemolytic disease of the newborn. Next is the type 3 hypersensitivity, which is about deposition of antigen-antibody complexes in tissues that will activate complement and neutrophil-mediated inflammation, which will lead to systemic lupus erythematosus and serum sickness. And the last hypersensitivity, which is type 4, it is mediated by T cells, occurs 24 to 72 hours after exposure, and it will lead to contact dermatitis, tuberculin, skin test, and transplant rejection. So now I'll be explaining about the mechanism of the allergic reaction. So the first phase, which is the sensitization phase, an allergen, for example, pollen, dust mite, or food protein will enter the body. Then the allergen will be recognized by the immune system. Then B cell will be activated with the help of Th2 helper T cells and undergo class switching and produce IgE antibodies that's specific to that allergen. Then IgE will bind to the mast cells. The IgE antibody will attach to the receptor on the surface of the mast cell, and the mast cell will be sensitized. And then the next phase, which is the subsequent exposure or re-exposure, the same allergen will enter the body again, and then the allergen will bind to 2 or more IgE molecules and in the mast cell surface by cross-linking, and then it will lead to mast cell degranulation, which is the cross-linking will trigger the mast cell to release stored chemical mediators including histamine, leukotrienes, prostaglandins, and cytokines. And then after this, the allergic symptoms will come because this mediator that released by the mast cell will cause first vasodilation, which will lead to redness. Second, increased vascular permeability that will lead to swelling or edema. Third, smooth muscle contraction that will lead to bronchoconstriction. And lastly, mucus secretion that will lead to runny nose and wheezing. And that's all for the mechanism of allergic reaction. So now I'll be explaining about the disease that I pick, which is the allergic asthma. So allergic asthma is the chronic inflammatory airway disorder with reversible airflow obstruction, bronchial hyperresponsiveness, and airway inflammation. And this is the most common type of asthma, which faced by 60 to 80% of the patient. And the causes could be vary, which first it can be from genetic factors, which is from family histories or genes, and then it can be from environmental trigger like dust mites, pollen, but then the mold, smoke, infections, pollution, exercise, or stress. And it can be from hygiene hypothesis. So the treatment for this disease is first to avoid triggers like dust mites, pets, pollen, or smoke. And then we also have the medicine that give quick relief like salbutamol and ipratropium. And then for long-term control, we have ICS, LABA, and leukotriene modifiers. And then we also have advanced therapies like omalizumab, which is anti-IgE, and anti-IL-5, and dupilumab, also SIT and SLIT. So for the acute and emergency care, we also have systemic steroids, oxygen, IV magnesium, and if severe, we also have ventilation. So the key point to treat this allergic asthma disease is to take medication and also avoid the triggers. This is the sources that I refer to do my SSM assignment.